Well, good morning and welcome. Thank you all for being here. For those that are in person and those who are joining us virtually, we really appreciate your attendance. We have a wonderful speaker today. I'm just excited to get rolling with it. Before I introduce our speaker who will be speaking to us today on people-centered kind leaders, the good life at work for our ASU Health Grand Round session for this month, I'd like to first say I'm Dr. Kristen Will. I'm Associate Dean for the John Shufeld School of Medicine and Medical Engineering, and also Executive Director at ASU Health and Clinical Professor. And it's my, just again, complete pleasure to have you all here. We do have a CME that we offer and CE across the interprofessional health professions. So if that applies to you, please take note of the evaluation that will be at the end of our session. Our speaker does not have any disclosures for the discussion today, and these are the accreditation bodies that we offer and acknowledge. There will be a Q&A at the end of our session. If you are online, we will encourage you to enter in your questions in the webinar format. We will be monitoring those and be taking those questions, as well as obviously those who are in person. And as I mentioned, the session evaluation at the end, there'll be time for that. We do offer refreshments at the end of our session. So yes, all you students, please grab some goodies to go on your way out, and all of our rest of our faculty and staff, we encourage you to take part in that as well. These, just a reminder, these are our objectives for our overall ASU Health Grand Rounds learning outcomes. And with that, I would like to introduce a friend and colleague and longtime collaborator, Dr. Steve Swensen. It's just a pleasure to have Dr. Swensen here. He's a sort of a Arizonan and a Coloradan, but by way of Minnesota. Dr. Swensen is a internationally renowned, recognized expert and speaker and interdisciplinary researcher in well-being, leadership, and organizational development. For 35 years, he's served patients at Mayo Clinic as a clinician, scientist, educator, and leader. His most recent books feature a blueprint for co-creating ideal work, Mayo Clinic strategies to reduce burnout, the 12 actions to create the ideal workplace. He serves as a senior fellow of the Institute for Healthcare Improvement and a transformational fellow at the NARBHA Institute. So with that, I'd like to welcome Dr. Swensen, and we'll turn it over to him, and I'll hand you over the clicker. So thank you.
Well,
Thanks so much.
Wonderful. Wonderful to be here. Appreciate the opportunity to spend some time with you. The best organizations in the world are filled with passionate people who are mentally, physically, spiritually, and socially well. That's the essence of people-centered leadership, which I hope when you're in a leadership position, you aspire to. A handful of years ago, I helped support a leadership retreat of a CEO of a large trust in the United Kingdom. The CEO opened the retreat by telling a story of her son who had just received a kidney transplant at one of her own hospitals. She summarized that experience with these words. She said, there was no love in the system. There was no love in the system. And without love in the system, patients suffer, staff suffer, and the outcomes are less than we would dream of and aspire to. When you look at healthcare professionals across the Western world, across the world for that matter, 40 to 50% are suffering from emotional exhaustion, cynicism, social isolation, moral injury or moral distress. They're impaired. There are more medical errors, there are more substance abuse, there's less communication, there's more disruptive behavior from people who are not mentally, physically, socially, and spiritually well. And so to fill that void, we have to look at things a little bit differently. Einstein said that the world as we have created it is a product of our thinking. And if we want to change the world, we need to change the process of our thinking. I grew up with the fairy tales of Hans Christian Andersen, the Danish author and writer. He said, just living is not enough. One must have sunshine, freedom, and a little flower. Most of us in this room will spend more time working than anything else in our lives other than sleeping. So I'd submit that just working is not enough. One must have agency, belongingness, collective effervescence, and a little positivity. And so that's what I'd like to share with you today. The essence of this are these 4 characteristics of ideal work. They are come from a synthesis of 537 articles that I reviewed of reasonable to high quality research over the last 7 decades by these great thinkers. And so the synthesis comes to these 4 achievable characteristics of ideal work. One of the studies was out of Newcastle, England. It was a controlled study of dairy cows where they measured milk productivity, and controlled study, they gave half the cows a name and used that name, and guess what? Their milk productivity skyrocketed 48 more liters a month, just because of that, of treating them with a little more civility. So after all these years, I finally come to understand with some evidence, when kindness comes in one ear, it goes out the other. Now I'm hoping there were a few more laughs in the, because 51 determinants of the good life at work. The good life I define as optimal health span and optimal positive life assessment. Of those 51 determinants, one of them was laughter and a good sense of humor in a large Scandinavian study of long-term mortality. So let's get into these 4 elements of ideal work: agency, belongingness, collective effervescence, and positivity. These 10 nurses are the happiest nurses in the country of the Netherlands, which is one of the 10 happiest countries in the world. Part of it is because their work is meaningful, their community health organizers and workers, and they're a group in this Birdsore group, the community health, that is the of 15,000 nurses, of teams of 10, and they don't have a boss. They are completely, every group of 10 nurses of the 15,000 nurses is self-governed. They, as a group, collectively, make decisions about the best things for the patients. They have the best community health outcomes in the world, and their practice is spreading from the Birdsore organization in the Netherlands across Europe and into America. And it's among the lowest tier of costs, so it's the highest value care. And the staff are delighted with their work because they have agency, some control over their work life. And Michael Marmot showed us, as well as many others, that when people have control over the work, cardiovascular disease, and they live longer. So what can we do in our work life to have a sense of agency, control over our work life? We've, for the last, I guess, 27 years, I've been working with organizations, including Mayo, where I spent most of my career, on this idea of removing pebbles. What we call it now is listen, sort, empower, where we talk to staff closest, doing the real work of an organization, and ask them, what are the pebbles in your shoes? What makes a possible day in your work life? and how can we have more of those best possible days? And you sort all those ideas by feasibility and sphere of control and impact. You pick one, you get to work on it. And so the beauty of this is you're empowering people doing the real work of the organization, not fixing something for them with their ideas, and who understands their work life better than the people doing the real work of the organization. So I'll just give you two quick examples. One of the, some of the pebbles are very simple. This group of 12 nurses liked their work and they admired their supervisor, but their pebble was, she sends us emails at night and weekend, and we feel like we have to answer them on the nights and weekends. And as soon as she found out this was an issue, she stopped doing it, and the pebble's gone, and the life was improved over could have been. Some of the pebbles are a little more. This are a physician, nurse, dyad leader in Intermountain Health Hospital, McAdee Hospital. The average rounding time for their ICU was 7.5 hours. And they just sat down and talked to all the staff about what are your pebbles? Is it the right information, the right equipment, the right coordination, the right communication? And one by one, it took a whole year, they took out those pebbles. See the graph at the end of a year of nothing fancy, no Lean Six Sigma, black belts, systems engineers. These are regular healthcare professionals close to the patient. They were down to 1.5 hour rounding times. Their morale went up, their patient action went up, and they ended up with a more productive system. So sometimes those pebbles are a little more complicated. I would be delighted to take questions at the end, and just to keep things on time, so because I know that you're done at 8:50. In the spring, I finished a 6-month engagement with Arizona. The one gathering that started during the pandemic of healthcare leaders across 80 some organizations, or several dozen organizations. Normally, some of these organizations are competitors, but they got together to say, how can we help each other through the pandemic? And the organization persisted, and now have had a couple of months of over 300 Arizonans attending. I had the privilege of leading for 6 months 80 leaders from 32 organizations, and we did this sort of hour. We talked about leadership behaviors, and period before and after we measured with a mini Z their morale, and everything from job satisfaction to values alignment went in the right direction in a statistically meaningful way by working with their staff, listening, sorting, and empowering them to improve their work life. Mayo, we've started this close to 20 years ago, and they took our idea to the 18 departments at Stanford, where he's their chief well-being officer, and 17 of the 18 departments had a statistically significant improvement in professional burnout, and 18 of the 18 departments had an improvement that was statistically meaningful in their staff fulfillment. So it works in multiple different settings. Agency is an important idea work element. Think about removing pebbles. Think about making the teams you already have more agentive, giving them more control over their life. Even if you don't go all the way to self-governance, people thrive when they have some value, some recognition to co-create their own future and co-produce. Belongingness is the second of these 4 ideal work elements, and it's a basic human need. If you look at where we're going in the Western world with social connections, we're going in the wrong direction. In the last 30 years, the number of, the percent of Americans who have no close friends has quadrupled. And and we become more polarized, and partly from being socially isolated, and partly from, so I won't get into that because I'm focusing on what we can do as organizations. But in the last 40 years, this is a nonpartisan look at some data that there's a shared responsibility for. 40 years ago, we love the in-group for the first time in 40 years. That we can't change society, maybe one behavior at a time, but within organizations, they're microcosms of our society. And if we can, in the relationships in our organizations, whether they're ASU or Honor Health or a public health group, connect people up in a positive way, we can change the microcosm of our society that has ripple effects beyond that. So Robin Dunbar is a world-renowned expert in relationships. He studied human relationships for 40 years, and Dunbar's number, he held for centuries, probably, and cultures. So we have the capacity, as of our neoprogram, 150 relationships, maybe 50 friends, 5 or 15 confidants and close friends. So the close friends, the confidants, teach us love. The friends, the tribes, teach us loyalty. And the village teaches us tolerance. And so when societies and organizations get out of balance in relationships, we need to more tribal affiliation than look at, or the love we learn from our confidants, then we can't struggle. So within organizations, we should look at how we relate to each other at different levels. And we treat each other. I love this story about Marina Levesque. Marina Levesque was a postdoc from Canada. And a few decades ago, she came down to work in Texas on some research to see if the diet of rabbits, the kibble, could change their cholesterol levels. And Marina Levesque ruined the experiment. Every rabbit that she touched, she picked up, she stroked, she talked to, she sang to, and all the rabbits in her study had off the charts low cholesterol. So what's true for rabbits is true for humans. Kindness, helping others do better, affects both our mental health and our physical health. So what single thing in humans can improve objective well-being or happiness to the same extent as if we have a net worth of $8 billion, improve our physical health by reducing our all-cause mortality by
a little bit of audio. I'll give you this as well.
By 35%. Well, there's a lot of research that shows us, including an 80-year-old study out of Harvard that started with JFK. It's meaningful relationships. If we have a long-term, confident relationship with anybody, that has those amazing dividends of $8 million worth of net worth, happiness, and a 35% reduction in all-cause mortality. So what can we do about this in our organizations? I don't know Italian very well. I was a German exchange student back in the 70s, but I love what the Italians taught us about this opportunity. It's a tavola non si fece. At the table, one does not get old. And so the beauty of this is this risotto effect. In the 1800s, early 1800s, Italians from this Roseto area near Rome started immigrating from their marble mines in Italy to the slate mines of Pennsylvania. And a few generations later, in the 1900s, in Oklahoma, scientists started looking at why don't they have any heart attacks? Why don't the men have any heart attacks in their 50s and 60s like the rest of the people in Pennsylvania and the region? And why are they all living longer? And it turns out that his analysis and then an NIH one 40 years later showed the same thing. It wasn't their diet, it wasn't their exercise, it wasn't working in the mines, it was their community spirit and sharing conversations and relationships in their neighborhoods that helped them live longer together. A tavola non si vecchia. So here's an idea. Commensality is a really fancy word for sharing a meal and a conversation with someone. And first studied in firefighters in Mayo. At Mayo, we've done 3 randomized control trials with healthcare professionals that tested everything from cortisol levels to social isolation, to emotional exhaustion, to depersonalization. And in these randomized control trials with healthcare professionals, all of those variables went in the right direction. So we started the commensality program maybe 15 years ago. Any group of 6, 8, 10 professionals that wanted to get together, share a meal with each other, a conversation with each other, we pay for their food. And the only concern that the board had in funding this was not the cost. It was that, and not the reliability of the data. It was, they said, everybody's so busy. No one's going to show up to these meals. And within, I think Mayo at the time had 5,000 physicians and scientists, and several times more, 1,000 nurses. Half of them showed up and arranged that within the first 18 months. So belongingness. Think about commensality programs in any organization where you get people together to build those social relationships. And then to the extent that you can, how can we have relationships at the family, tribe, and village level that balance the love, the loyalty, and the tolerance that we need for a highly functioning organization. Collective effervescence. I love this word. It was coined by French sociologist Emile Durkheim a century ago. And it means it's the harmony and the energy and the meaning that people experience when they come together with a shared purpose. I love this Bjorn Sjogren painting that we chose for the cover of our book. And it was, Sjogren saw a group of athletes in Sweden jumping up together in unison, preparing for their workout to be the best team they could together. This is another way that collective effervescence works. For the last 4 years, I worked with a team of 4 at the Institute for Healthcare Improvement with 33 leaders from Region Jönköping in Sweden. And their mission, Tillsammans Eppra Liv för alla, is together, the good life for everyone. And the foreign-born population in Sweden is now 21%. And they wanted to make sure that everyone felt welcome in Jönköping, regardless of their background or religion or what they ate or how they dressed. And so the spirit of this group coming together on this shared purpose felt like collective effervescence. There was a lot of energy. Most of them had never met each other, but we got together working to improve the good life, optimal health span, optimal positive life assessment for everyone, including the 21% of their new neighbors. Here's another picture of what collective effervescence looked like. These are among the lowest paid people at Mayo Clinic. They worked in our largest hospital, St. Mary's in Rochester, Minnesota, in the basement where there's no natural light. Their job was to sterilize endoscopes and sanitize soiled sheets. And yet their engagement and fulfillment was off the charts because in large part, Mary Mokel, their supervisor in the red vest or blazer, connected them to the meaning and purpose of their work. And in their own words, on the whiteboard, when you went into to their no natural light basement at St. Mary's Hospital, was people are alive because we're making sure the endoscopes and the sheets were properly cleaned. So when I was head of leadership development at Mayo, and when I was a chair, Hugh Smith was our CEO. We would get together every Wednesday morning at 7:30 and meet and share ideas. And I remember one morning we were looking at staff satisfaction, and Chet Rehal, who was then the chair of radiology or of cardiology, said, "What I do is every time I meet with staff one-on-one, I ask them, what brings you joy in work?" He was getting at what is their ikigai? What is your reason for being? And most people had a perfunctory answer, and then almost all of them came back a month or a week or a quarter later and said, Chad, I had a chance to think about that, and I really have a passion for teaching. I really have a passion for patients with diabetes who are in high socially vulnerable neighborhoods. I really have a passion for doing improvement. And it turns out Tate and others have studied this with, I think, just under 500 physicians. When physicians or any other human beings were doing at least 20% of their work day or work week or work month on what they themselves had determined was most meaningful to them, they had half the rates of burnout. And we see this across cultures and across businesses as a way to buffer ourselves from professional burnout and moral distress, to get at least 20% of your time on what is most meaningful to you. And so it's called job crafting in the literature. I like the term life crafting because it's all together. What's most meaningful to you? Since the 90s, I've kept a list. It used to be on paper, now it's digitally, of the 10 most important things in my life that are most fulfilling to me. It's changed over the decades. And some of those are family life and friends life. And if you're working and you have any kind of career that fits your heart, some of those top 10 should be your work life. And you should look at that and see if these are the 10 most important things in my life that are most meaningful. Does your calendar match what you say is most important to you? And if the work-life calendar does, then your immunity to burnout will be much higher than if not. There are three different ways you can job craft or life craft. One is just change your perception. This is Iris Kroger. She's a environmental services specialist at Mayo, and some people call her a custodian. She says her job is to save lives. She knows. She worked with Bob Seema, GI surgeon, on sampling bacteria cultures all over the rooms. And without anybody telling them what to do, the environmental services folks put together a checklist because they saw nurses and doctors with checklists. And Iris and her team has a checklist that said the first thing you have to sanitize is the remote control to the TV because that's where the most bacterial colonies were growing. And so they're part of the team. And she didn't change her job, allocation. She just changed her perception of what she's doing, and you can change with whom you do your work to help get more of the collective effervescence. So you can do the same thing with a group of people you really admire and trust that can help in your job crafting, or you can simply just change your allocation. If you really like seeing folks with COPD, then you can change your allocation of that to improve that. So a couple of footnotes here with meaning and purpose at work. The misuse of money can corrode well-being. I'll give you two examples. So this is James Harrison. He's from Australia. He's known as the man with the golden arm. Over his life from 18 to 81, he donated 1,173 units of his rare blood. That brought him meaning and purpose, and that was part of his ikigai, his reason for being. So what happens when you start paying someone to donate blood who was formerly doing it without compensation? People stop donating blood because you've taken a gift of love and turned it into a financial transaction, and you've corroded the intrinsic meaning of that act. If you look at production models for physicians, even if it's only 10% of your total compensation, if you are paid on a production model for more surgeries, more images, more appointments, more lab tests, more money, then your rates of professional burnout skyrocket. Multiple studies across multiple disciplines in America. So we have to be real careful with how we use money and how that can interfere with the professional well-being of all the professionals that are involved, and money can corrode it if we're not careful. So for collective effervescence, think about connecting to the meaning and purpose with job crafting, and be careful with money. So the last of these four elements of ideal work is positivity. And I'm sure some of you are rolling your eyes, and this is not toxic positivity. This is genuine, authentic, looking at opportunities to make the world a better place. There are many studies. There are four very large, credible epidemiology studies, one in nurses, one in veterans, one done in Mayo Clinic across the general population, and in the fourth that I'm blanking on for the second. All of them showed that one was nuns, Catholic nuns, and looking at their diaries over decades. And all four of them showed that the more positive, optimistic approach to life resulted in a more positive life assessment and a longer life with longer health span. So what we think we become. One of the most powerful drivers of well-being that healthcare professionals are a bad outlier on is self-valuation. Self-valuation is simply how we treat ourselves as we would choose to treat other people in regard to harmful events, in regard to prioritizing self-care. If you look at leaders that have higher self-valuation, they have lower rates of burnout, and their staff has lower rates of burnout. So let's get maybe a little more specific. The two choices we make to improve self-valuation, the first choice is when there is a mistake, when there is an imperfect human condition, when there is an error, the best approach to that is to console and look for ways to improve with a Carol Dweck's growth mindset. This is an opportunity to learn and improve, and not to self-condemn. And healthcare professionals, doctors, nurses, the whole team is much poorer at that than the general population. The second choice in self-evaluation is self-care. And here, in a big study on physicians, doctors are half as likely to prioritize their own self-care, diet, exercise, time alone, sleep, as those in the general population. So it's a matter of, so the best thing to do as a leader and as a staff member is to look at errors and personal imperfections as opportunities for improvement in a growth mindset, and to prioritize your care so you can be a better person and a better caretaker and a better staff member. The Gottmans, Julie and John Gottman, are professionals and professors who've studied relationships or marriages of all flavors for their careers. They've studied, I think, over 45,000 different marriages. And they came up with this ratio of 5-to-1. The marriages that are most likely to be durable and successful and joy-filled are those that have a 5-to-1 ratio of good to bad, of positive interactions, of affirmations and thoughts and gestures and body language, than the marriages that are more likely to fail. So positivity in relationships, you can quantitate it to some extent. And if your only goal in life is to ride a bike faster, then positivity helps too. This is Alex Richardson. He used to be track oil shipments across the world in an office in London. And he said, I really want to be a Tour de France bike rider. So he quit his job, and he had a trainer that, all evidence-based, that did a bunch of things, including 2 things. First of all, he sleeps in an air altitude tent like this to have the altitude, the amount of oxygen about the same as being at Vail at 8,200 feet, so he had more red blood cells, he could bike faster. But the other thing he did is was fascinating. Very intentionally, he surrounded himself by people who loved him, who cared for him, who believed in him, and didn't have any question of him leaving his very lucrative job tracking oil shipments, because when you have friends and family supporting and loving you, your interleukin-6, your cortisol levels, your heart rate variability, your resting heart rate, your recovery times all go in the right directions, and you can bike faster. So positivity makes a difference physically, mentally, and we should embrace it as a goal for our work environment. So Viktor Frankl, Holocaust survivor, in his book, Man's Search for Meaning, said that everything can be taken except for one thing, the last of the human freedoms, our ability to choose our attitude in any given set of circumstances. And so the idea is, and he observed this in Auschwitz and in life, we have some agency to choose how we're going to frame this opportunity in our lives. And Mandela did that. He spent a third of his 90-some years in an apartheid prison, and he said, I never lose. I never lose. I either win or I learn. Don't judge me by my successes. Judge me by the number of times I've fallen down and gotten back up again. So this positivity is this growth mindset of how can we improve our lives and those around us, and not be fixed and not look for losers. In the workplace, it comes down to one key phrase. So Gallup, in looking at 155 different countries across planet Earth, there was one phrase that universally was the most strongest predictor of likelihood to be engaged in your work, likelihood to stay, and likelihood to flourish in your job. And that was, my leader, my manager treats me like a person. And what do you call a leader who doesn't treat you like a person? What a bad boss. And at the Karolinska Institute, they measure this. Bad bosses cause more heart attacks among their staff. So I think when we're looking at the ideal positive work environment, you have to start talking about leader behaviors. And I would submit that we should consider the servant leadership idea of seeking to understand the needs of the staff and prioritizing their flourishing to have the organization flourish. It's what Ingersoll said. He said, "We rise by lifting others." That's the spirit of these 5 behaviors I'd like to share with you. We rise by lifting others. Nick Seibert, this was published a few years ago in the Harvard Business Review. He took a micrometer and measured the signature size of Fortune 500 CEOs and looked for a relationship between the size of the signature and the success of the company. Any guesses? The larger the signature on these annual reports, the more likely that there was to be a budget shortfall, to be a lower margin, a shrinking market share, all related to the size of that signature. So these 5 behaviors that I'll share with you are basically predictive of micrographia in the leaders. This is something we started measuring 20 years ago at Mayo. So we first started this with physician leaders, 242 titled physician leaders, and then it worked so well we scaled it to 3,100 point of care nursing leaders and accounting leaders across the board. These 5 behaviors for a small increase in performance through the eyes of the staff that are surveyed every year on their morale and parking, and these 5 behaviors of leaders had oversized responses in improvements in fulfillment and reductions in burnout of the staff. See these 5 behaviors. The first is, first seek to understand, listen to understand. And so in our work in Sweden, we learned from this Emma Sundström, who's a professor at the Stockholm School of Economics, with this bubble hopper idea. And it's basically sitting down with someone, and we did this in Jönköping, with someone who, an anxious teenager, and just listened. A Muslim immigrant, and just listened. An elderly person who was lonely and isolated in their house, and just listened. A truant teenager who didn't show up to school the last 3 days, and just listen. So at work, even if you know the right answer, it's better to listen and collectively come to that than to just do it. Appreciation, gratitude, practice you can add every day to your gatherings, starting with something that you or a member of the team appreciates. Focus on that. There's a ton of literature on the value of gratitude and how well that can be good for us. Mentorship, coaching. The 4th behavior relates to belongingness. I spent a little time working in Denmark. This idea of venligboerne is friendly inhabitants. So that they've, in the last generation, they've had an increase of 11% to 11% of their population is foreign born. And the citizens said, we want to welcome these new members to our neighborhood. And so they started with a nurse that started this, um, um, with directions and clinics and training for how to welcome these refugees and migrants to Denmark. And now it's spread to 12 years ago, and now it's in 101 communities. They have close to 200,000 volunteers that just will meet with and welcome these new. So the idea at work is everyone should feel welcome and respected, regardless of their genome or phenome in your workplace. And we should measure that, and we should hire to it. And the fifth behavior is transparency. I got a chance to meet Michael Bush a few years ago. He's the president and CEO of Great Places to Work. He said, to summarize 30 years of research about the great places to work, he said, the root of the tree is trust. And transparency grows trust. Open the books to everything that's not confidential and say, let's figure this out together. So those are the 5 leadership behaviors. I'd say they're about character. General Schwarzkopf said, leadership is a potent combination of strategy and character. But if you must be without one, be without the strategy. So when I was head of leadership development, I would meet with each department chair. These are the leadership scores based on those 5 behaviors from annual staff surveys of staff answering 12 questions about those 5 behaviors for their immediate report chair or supervisor. And I wouldn't name them, but I'd show them, this is your dot. And here are the questions. How can we work together to help you be a better leader? Full transparency. These leaders' behaviors make a difference in the well-being of staff and the outcomes for patients, and so we focused on them. That CEO I talked about early on that said there was no love in her system where her son got his renal transplant, this is what she did. She started with those leadership behaviors for herself, her senior team, next layer down, all the way down next to the patient, because she thought that was the most important thing she could do for the well-being of the staff. So that's the 4th of those ideal work elements. Self-valuation is worth focusing on. It's a cultural change. That's not easy. The 5 behaviors, you can start measuring those tomorrow. I do have a couple minutes left, so I wanted to share this study by Laura Ackman. She's a professor at University of British Columbia. She studies toddlers, and her metric in this research study was toddlers' smiles. When she gave a cracker to a toddler, they smiled this much. When she gave a cracker to a child to share with another toddler, they smiled this much. Here's the cool part. When she gave a cracker to a child, to the toddler, that the toddler could have kept for his or herself, and they gave that cracker away, they smiled this much. So people-centeredness is about giving crackers to people. It's good for the organization, it's good for the person giving the cracker, and it's good for the person receiving the cracker. I started my career in quality at Mayo, and Phil Crosby back in the 70s wrote a book about quality being free. And now everybody takes that as, of course it's free because of all of the cost of rework and so on. I would say that people-centeredness is free. And we have a chapter in the book that shows the business case for this, where the cost of hiring, the cost of turnover, the cost of productivity from low morale, the cost of patient or customer satisfaction, all related to the well-being of staff that is related to people-centeredness. So we can do well by doing good. And so I'll just end with what Mildred Taylor taught us. So many things are possible as long as we don't know they're impossible. Thank you. I know that many of you have to go to class, but we do have 10 minutes left before the top of the hour. If there are any questions or comments, I'd be delighted to have a little dialogue.
I'm very happy to actually start with gratitude. To have a couple of questions. So how can, I mean, this is a remarkable body of work and it's clear. About implementation. How can an organization like ours be intentional about implementing all of these in all of these directions and kind of keeping an eye on things and making sure we continue to be true?
Thanks, Shireen. That's a great question. I think that I think it starts with the senior leadership saying it's important to us to have staff and students that are well, and that sets up the organization to flourish. So I would start with a vision. You just stated it. And then if you have a vision, you have to have a measurement system. So I would have some sort of, doesn't have to be anything real fancy or expensive, but a regular annual measurement system for what we want to understand and what we want to improve. So if we want fulfillment to go up or the engagement to go up, or so some sort of measurement system, and then pick, we have 12 actions that we know work. And and so in talking to the staff, the right answer, I think, comes from the staff. So what is most important to you? Is it engagement? Is it teamwork? Is it camaraderie? Is it work-life balance? And then say, okay, well, let's work on that. And then here's some tactics that we've seen work in London or Stanford or right here at ASU. But ASU is a big place. I bet there's probably a best practice for everything at ASU, but it's not everywhere at ASU. So I'd say vision, measurement, and then a strategy with tactics that are based on what we hear from people whose lives we're trying to make better. So.
Hi. First, also gratitude. I thought this talk was fantastic and filled with so much evidence-based suggestions for how to create this kind of model for both a system, right, an institution, and also our wider choices that we make in our self-governance, for instance. The question I had is, to me, a lot of the times the barriers to the kinds of behaviors that you are promoting in this model, the barrier is fear a lot of the time, right? Fear of giving up resources that have been, that somebody has, or fear of the other as somebody who will somehow impinge upon the rights or the privileges of one group. And so fear of another group that might come in. And I would love to hear you comment on fear as an element that often mitigates against many of the really positive interventions that this kind of system might suggest.
Fear is a real issue in life and organizational life and society. I think the communities and organizations and work units that flourish, one of their characteristics is instead of being motivated by fear or what if, they're motivated by an aspiration. And so I think one of the best things we can do as a leader is to together with the team say, what is this beautiful future state that we want to be in, where all the pebbles are being removed, and where we can connect people to this beautiful mission that we have of education and learning, whatever your group is. But I would step back and acknowledge that fear is real and an issue, and then put that aside and say, what is it we want to be? And what could we be? And how can we be this beautiful new future state and I think that's a better, more effective way to lead and have that driven by, the collective excitement of a Bertsorg team of nurses saying, we have no one, we're self-governing, so we can do this, and the naysayers will eventually join up and say, what can we learn from you so we can do that too?
Thank you. I believe we have some questions. Dr. Wong is.
Yeah, there's a question from Zoom. I think it's similar. What's your advice on leaders who don't prioritize kindness efforts to lead?
So this is something that he's asking about. What about leaders who don't prioritize kindness? And this is where role modeling and leader examples make a difference. So if we as leaders can model the behavior we want for all of our leaders, that's the first step. And so, and just the example of how we work with people, address people, treat people, have conversations with them is a powerful way to spread that. And then we need to set expectations for behaviors in organizations. One way that's very concrete is to measure behaviors. And another concrete way is if there's behavior that's outside of what we want for a supportive, caring community of educators and researchers, that we have conversations with the people who fall outside of that, because staff will pay as much attention to the goodness of your behaviors as to what you do with people who are disrespectful or disruptive. That's as powerful of a message about this is the kind of community we want. We want diversity, we want an opinion and diversity in every element, except meanness. So I think we just consciously and intentionally set limits about this kind of behavior was not respectful, and we aren't going to tolerate that. We have a conversation, and then we have, progressive performance management for behaviors that don't work in a civil society or don't work in a civil organization like ASU. So I'd start with the aspirational of modeling the behavior, open, whatever it is, by actions and words that show this is what we should be doing, and modeling that, and then an intolerance for behaviors that don't fit within a civil organization. So I think it's 10 o'clock, and I thank you very much for your time, and it was nice to spend an hour with you.
Thank you. Thank you so much. Wonderful. Thank you so much. For those that are seeking continuing education credits or evaluation code, you can use our code. For some reason you have difficulty with it, we always follow up with an email and link. So thank you so much for coming. Refreshments for those that can join us, and for those online, thank you so much for joining.